Good afternoon. Welcome to the April 2021 West Bend Mutual Insurance Edition webinar on driver health and safety. My name's Joe Wimmer. I have the privilege of introducing our webinar here this morning. We're going to have Samantha Brooks, Dave Moore, and Carrie Freed introducing and presenting on driver health and safety. So with no further ado, I will turn it over to Carrie Freed.
Thank you. As Joe said, welcome to our Driver Health and Safety webinar. We are pleased you can join us today. This webinar was developed by 3 members of our Transportation Advisory Team, Samantha Brooks, David Moore, and Carrie Freed. According to the Centers of Disease Control and Prevention, life behind the wheel makes it difficult to live healthy due to irregular schedules, long hours, little physical activity, limited access to healthy foods, and also stress. So during today's webinar, we will identify common root causes to driver ailments, and then techniques to create healthier choices and lifestyle changes from behind the wheel. 10 years ago, drivers of heavy and tractor-trailer trucks accounted for more than half of all production and non-supervisory employees in the truck transportation industry. Yet at that time, there was little to no information gathered about illness and injury trends in these long-haul truck drivers. So this prompted a national survey. The National Survey of U.S. Long-Haul Truck Driver Health and Injury interviewed 1,670 long-haul truck drivers at 32 truck stops across the 48 contiguous United States. The survey was completed in order to compare selected health behaviors and modifiable risk factors of U.S. long-haul truck drivers to the average U.S. working population by sex. In other words, just how damaging is driving for a living to our health. The survey results found that long-haul truckers were 2 times as likely than the U.S. adult working population to currently smoke and to be obese. More than half of the truckers surveyed reported having 2 or more of the risk factors, such as hypertension, obesity, smoking, high cholesterol, no physical activity, 6 or fewer hours of sleep per 24-hour period, all these often leading to more complicated disease within our bodies. These survey findings demonstrated the need for a targeted assistance to long-haul and short-haul truck drivers alike. Working conditions common to trucking create significant barriers to certain healthy behaviors. Transportation and health and safety professionals are trying to address this unique work environment by developing and communicating healthy solutions to the drivers. We at West Bend Argent are attempting to do our small part today with this webinar. We care about the truck drivers that work for our clients, and we want to do our best to communicate possible solutions to help them remain healthy. Being obese or overweight can increase the risk of other health problems, such as heart disease, diabetes, high blood pressure, sleep apnea, lack of physical activity, and high cholesterol. And in fact, 1 in 4 of the truckers surveyed admitted to never having their cholesterol even tested. The definition of obese by Merriam-Webster is having excessive body fat. But how much is too much? The calculator on the left from the Centers for Disease Control and Prevention provides body mass index, otherwise known as BMI, and the corresponding BMI weight status category chart on the right is for adults 20 years and older. Because the BMI calculation requires only height and weight, BMI is an easy and inexpensive tool to determine our weight status. Are we underweight? Are we normal or healthy weight? Are we overweight or obese? BMI can be a screening tool, but it does not diagnose the body fatness or health of an individual. To determine if BMI is an actual health risk, a healthcare provider performs further assessments, such as skin fold thickness measurements, evaluations of diet, physical activity, and family history. Here's a quick example for someone that is 5'9", and the weight ranges, corresponding BMI ranges, and the weight status category for that person. And if you look at the different weight range and then the BMI that establishes, it may give you an idea of just how little extra weight it takes to be considered overweight or obese. The bottom line is that managing your weight contributes to good health now and as you age. Strategies for managing your weight while on the road and while maintaining a busy lifestyle will be discussed later in this webinar. The national study found that more than 1 in 4 truck drivers said they have high blood pressure. So blood pressure is the pressure of blood pushing against the walls of your arteries. Arteries carry blood from your heart to other parts of your body. High blood pressure, otherwise known as hypertension, is when your blood pressure rises and stays high for a long time, which can lead to heart damage and other health problems. It can also raise your risk for heart disease and stroke, which are 2 leading causes of death in the United States. As a reminder, blood pressure is measured using 2 numbers. The first number, called systolic blood pressure, measures the pressure in your arteries when your heart beats. The second number, called diastolic blood pressure, measures the pressure in your arteries when your heart rests between beats. A normal blood pressure reading is less than 120 systolic and 80 diastolic, or 120 over 80. And truck drivers must have a blood pressure of 140 over 90 to work. Anything higher than that can possibly keep you from earning a living in your chosen profession. According to William Shield Jr. and the CDC, high blood pressure is known as the silent killer. The consequences of high blood pressure depend on the severity and the duration of the pressure, along with the underlying medical condition of the person affected. In most cases, there are no symptoms at all, so people with high blood pressure can be having damage occur to their heart, kidneys, eyes, and circulation without even feeling badly. High blood pressure can affect the heart and cause shortness of breath, chest pain, and heart attack. High blood pressure can affect the function of the kidneys, leading to fluid retention, swelling of the legs, and even kidney failure. High blood pressure can affect the eyes and lead to vision loss. It can seriously affect the circulation in the body, causing pain in the legs with walking, cold feet, and stroke. People with uncomplicated high blood pressure may experience headache, blurred vision, dizziness, and shortness of breath. So it's very important to routinely test your blood pressure to ensure it is within the healthy range. You can get your blood pressure checked by a healthcare team member at a doctor's office, or at a pharmacy that has a digital blood pressure measurement machine, or at home or in your truck with a blood pressure monitor that you can purchase and use yourself. When high blood pressure is detected early and treated and continuously monitored, the harsh consequences described can be avoided. The National Truckers Study found that 14% of truck drivers said they have diabetes, compared to 7% of the U.S. working population. Diabetes is a disease that occurs when your blood glucose, or blood sugar, is too high. Blood glucose is your main source of energy, and it comes from the food you choose to eat. Insulin, which is a hormone made by the pancreas, helps glucose get into your cells to be used for energy. Sometimes your body doesn't make enough or any insulin, though. So glucose then stays in your blood and doesn't reach your cells. Therefore, you're getting no energy. Long term, having too much glucose in your blood can cause health problems such as heart disease, blindness, kidney failure, and lower extremity amputations. We thought it important to highlight health concerns specific to women truckers as well. According to Dr. John McElligott, co-founder and volunteer medical advisor to St. Christopher Truckers Relief Fund, the most prevalent health issues facing women truck drivers are heart disease, migraines, obesity, breast and cervical cancer, and respiratory disease. According to McElligott, studies show that 1 in 4 women truck drivers die from heart disease. He says, the best pump you'll ever own is your own heart. This really emphasizes the importance of taking good care of our own heart, our own bodies. Job stress, personal anxiety, hormonal changes can all contribute to migraine headaches. Women are 3 times more likely to have a migraine than men. In fact, 85% of migraine sufferers are women. McElligott explained that migraines have auras, or symptoms that are caused by specific triggers, prior to the headache becoming a full-blown migraine. By seeing a doctor, truck drivers can help identify these triggers and what is causing the migraine, and then safely figure out a plan to eliminate them. Some recent studies by Healthy Trucking of America report that more than 50% of women truck drivers are suffering from obesity. Women are 5 to 8 times more likely than men to have thyroid problems, which is a strong contributor to obesity. Liver disorders and knee joint issues are common symptoms of obesity in women. You have no idea how many women I've seen jump out of their cabs, putting immense strain on those joints. Don't jump out of your cab. 3-point exits out of the cab are recommended to help sustain the health of your joints, McElligott explained. Breast and cervical cancer are on the rise amongst women truck drivers, which emphasizes the importance of annual physical exams, or more often if things just don't feel right. Early detection is key for both breast and cervical cancer, since both are highly treatable when caught early. Almost half of women truck drivers are affected by respiratory diseases, such as asthma, emphysema, hay fever, chronic bronchitis, and more. Since smoking is one of the leading causes of respiratory diseases, McElligott encourages these women truckers to stop smoking, but much easier said than done. So some ideas of how to stop smoking will be shared later in the webinar. COVID-19 was at the center of many discussions regarding employee safety in 2020, and truck drivers are no exception. McElligott says, one of the things I found is patients who go into the hospital, urgent cares, emergency rooms, and who end up dying tend to have low vitamin D levels and suffer from obesity. McElligott urges truck drivers to get the coronavirus vaccine as soon as it's made available to them. Having one or multiple health concerns like the ones we have discussed so far today can lead to a life of illness and chronic conditions, of having to always treat what already went wrong. But this is preventable if we learn and implement new habits now that are realistic and sustainable. It makes a lot of sense to use our energy to stay well now instead of having to use extra energy to get better later.
Thank you, Carrie. This is Dave. I'll now be talking about driver nutrition, and I'm going to start out by going over the new nutrition facts label. The nutrition facts label is on food packaging to support your personal dietary needs. Choose foods that contain more of the nutrients you want to get more of and less of the nutrients you may want to limit. Choosing healthier options in beverages can help reduce the risk of developing health conditions such as high blood pressure, high cholesterol, cardiovascular disease, diabetes, and obesity. The U.S. Food and Drug Administration updated the nutrition facts label on packaged foods and drinks last year. The FDA required changes to the label based on updated scientific information and new nutrition research. This was the first major update to the label in over 20 years. The refreshed design and updated information was intended to make it easier for you to make informed food choices. Overall, the label looks about the same. So what has changed? Let's take a look section by section at the new label, and I will highlight what is new and what it means for you. The first section at the top of the label is the serving size section. It shows the amount of servings per container and what the serving size is. The serving size is usually indicated by the amount of pieces, using chips for example, or by volume, as in cups. This is now in large and bold font to highlight this important piece of information. Serving sizes also have been updated to better reflect the increased amount people typically eat and drink today. Note that the serving size is not a recommendation of how much you should eat, but an estimate of how much people will actually eat. The nutrition information listed on the label is usually based on one serving of food. However, some containers may also have information displayed per package if the entire package is estimated to be the serving size. Sorry, I jumped ahead a slide. This label states that there are 8 servings in this container and that each of the 8 servings is 2/3 of a cup. The next section on the label is the amount of calories per serving. This information is now in larger and bolder font to make the information easier to see. Calories per serving is an important part of the label to read when comparing different food choices. You can use this information to compare similar products and choose the one that is lower in calories. A 2,000 calorie a day diet is used as a guide for general nutrition advice. Your calorie needs may be higher or lower depending on your age, sex, height, weight, and physical activity level. You can estimate your individual calorie needs at the choosemyplate.gov website, which we will go through in a few slides. The third section in the label is the percent daily value section. This section shows how much of a nutrient in a serving of food contributes to the total daily diet based on a 2,000 calorie a day diet. If you eat more or less than the 2,000 calories a day, these percentages will vary. The daily values for nutrients may have been updated with the new label, which may make the percent daily value higher or lower on the new label compared to the old one. As a general rule, 5% daily value or less of a nutrient per serving is considered low, and 20% daily value or more of a nutrient per serving is considered high. The listed nutrients section has been updated to include added sugars, vitamin D, and potassium. Added sugars need to be limited, so it was important to determine how much sugar was added to a food compared to how much was already in the food. Vitamin D and potassium deficiency have been linked to many chronic health conditions, so were added to this list. Calories from fat, vitamin A, and vitamin C have been removed from this list. The calories from fat has been removed because research shows that the type of fat consumed is more important than the total amount of fat. The amount of saturated fats and trans fats are more important to know than the total amount of fat because saturated fats and trans fats are what we want to limit and avoid. The typical American diet is low in fiber, vitamin D, calcium, iron, and potassium, which is associated with poor health. Because of this, they are now listed on the label to encourage Americans to include more of these important nutrients in their diet. Most Americans exceed the recommended limits for saturated fats, sodium, and added sugars. Compare and choose foods to get less than 100% of the daily value of these nutrients each day to improve your health. The vitamin A and vitamin C daily values were removed from the label because deficiencies in these vitamins is rare today. The 5-20 rule is a great guide to make healthy eating choices. When reading nutrition labels, choose 5% or less of saturated fat, sodium, and added sugars. These are the 3 nutrients that are overeaten, causing many chronic health conditions. Also, choose 20% or more of dietary fiber, vitamin D, calcium, iron, and potassium. These nutrients are important for disease prevention and are often lacking in American diets. Follow the 5-20 rule of thumb when reading labels and making food choices. On the FDA website, there is a small wallet-sized card that you can print off and use as a handy reference when reading nutrition labels at the grocery store. This has the 5-20 rule of thumb information included. This can also be downloaded as an app for a smartphone. The ingredient list is also a helpful tool. The ingredient list at the bottom of the label shows each ingredient in the food by its common name. Ingredients are listed in descending order by weight. So the ingredient with the greatest contribution to the product, tapioca starch, is listed first. And the ingredient contributing the least by weight, salt, is listed last. If you are wanting to reduce your salt intake, this may be a good food choice because the salt is the last listed ingredient, indicating that salt makes up the smallest ingredient by weight. The MyPlate program is another great source of information for nutrition decisions. The myplate.gov website has a large amount of useful information. Some of these resources are broken down into topics, such as sugar, for example. The MyPlate food intake recommendations can be boiled down to this picture of a dinner plate. The plate visually shows how much of each food type you should eat by the amount of sitting on the plate. About a quarter of the food on the plate should be vegetables, another quarter of the plate being grains, especially whole grains. Protein and fruits should make up each less than 1/4 of the plate. Dairy products should be limited to a proportional size as well. Here are some general recommendations from the MyPlate website. Focus on making healthy food and beverage choices from all 5 food groups, including vegetables, fruits, grains, protein, and a dairy or fortified non-dairy alternative to get the nutrients you need. Focus on the variety, amount, and nutritional content of food sources. All food and beverage choices matter and add up. Make half your plate fruits and vegetables. Focus on whole fruits and vary your veggies. Eat your colors is an often used phrase for vegetable choices. When choosing protein, choose seafood and lean proteins like skinless chicken and lean cuts of meat. Don't forget about other sources of protein like beans, peas, lentils, eggs, nuts, seeds, and soy products. Try whole grains such as oatmeal, popcorn, and brown rice as snacks or side dishes. Also, switch from the refined grain to whole grain versions of commonly eaten foods such as breads, cereals, and pasta. Whole grains are important sources of nutrients such as zinc, magnesium, B vitamins, and fiber. Try fat-free, skim, or low-fat dairy products such as milk, cheese, and yogurt. Dairy products also provide important nutrients like calcium and vitamin D. In general, choose foods and beverages with less added sugars, saturated fat, trans fat, and sodium. Recall that the food nutrition labels are based on a 2,000 calorie a day intake. To estimate the amount of calories that you need to consume daily, use this online tool, which I will show you screenshots of. The screenshot on the left, number 1, is when you first enter the website, click Start, and then you enter your age, your sex, and your physical activity. Then you add your height, and it calculates for you how many calories you need a day. So in my case, it's saying if I want to achieve a healthy weight, I need to consume 2,600 calories a day. And if I want to maintain my current weight, I need to consume 2,800 calories a day. Use the nutrition label and myplate.gov information together to make healthier food choices. There is also a MyPlate app available on the myplate.gov website for smartphones that may be a useful tool to help you track your choices and progress. Let's apply this label information to some daily decisions. Let's say you were fueling up at a truck stop and decided to get a snack. Either yogurt parfait on the left or the cheese curds and sausage on the right. Recall the 5-20 rule where we want 5% or less of the daily value of bad things and 20% daily value or more of the good things. The parfait label on the left is low in cholesterol and saturated fat at 5%, while just over 5% in sodium at 7%. It also has 240 calories. This fits the 5-20 rule pretty well. Now let's read the label on the cheese curds and sausage option. It has 95% of the daily value of saturated fat, 35% for cholesterol, and 48% of sodium. That means if you choose this, you will have eaten almost all of your saturated fat for the entire day and almost half of the sodium. All of these values are well beyond the 5% that we want to keep under. It also has 440 calories, almost twice as much as the parfait. Clearly, the parfait is a healthier option to eat for a snack. Now let's look at 2 prepackaged chicken options that I found at a truck stop. Either fried chicken on the left or grilled chicken on the right. The fried chicken has 65% of your daily saturated fat, while the grill has only 3%. For cholesterol, the Fried chicken has 40% of your daily compared to 17% for the grilled. Sodium is the big kicker, with 83% for the fried and 22% for the grilled. The calorie difference is also substantial, 690 calories for the fried versus 90 calories for the grilled. Clearly, the chicken is a much healthier option and mostly falls within the 520 rule. The sodium in the grilled chicken is likely more than it would be in home grilled chicken because it is a prepackaged food, and salt is often used as a preservative in most prepackaged foods to give them a longer shelf life. High sodium is a root cause of high blood pressure and is a nutrient to really pay attention to. This becomes more of an issue when eating on the road because fast foods and convenience foods tend to have high sodium levels. Sodium is low in natural foods, but is often added as a preservative to prepackaged foods, like those purchased in a convenience store. This is why the same food purchased ready to eat will have higher levels of sodium compared to when you make the same food at home. This is a specific dietary guideline for lowering high blood pressure and cardiovascular risks, called the DASH eating plan. There's a wealth of information online if you Google DASH eating plan. Research on the DASH eating plan has shown that it can lower blood pressure in 2 weeks. Here are some other general tips to lower your salt intake. Read the nutrition labels and compare foods. Rinsed canned vegetables before eating or cooking to rinse away the added salt used as a preservative in the canned water. Eat more home-cooked meals that you can heat up on the road. Limit processed and prepackaged food intake, and substitute other spices for salt. The MyPlate.gov also has hundreds of recipes that have been sorted in many ways, including by what food equipment is needed to prepare them. This works great for long-haul drivers because you can only search recipes that need what you have in your cab, such as a microwave, slow cooker, or mini oven. There are even dishes that do not need any cooking at all. All of these recipes fall within the MyPlate dietary guidelines and are healthy options. Now that we have some healthy recipes, let's see how we can prepare them out on the road. There is a large variety of cooking appliances for under $50 that can be used in the cab. Most people are familiar with the availability of microwaves and refrigerators in cabs, but it doesn't end there. There are a variety of portable stoves, slow cookers, hot water kettles, steamers, and other appliances available. Some of these appliances have not worked well in the past and have been redesigned, so you may need to see what has changed if you've looked before. There is a good selection of YouTube videos where drivers review these appliances while using them on the road. They also have recipes and tips to offer. Learn from their experiences. Invest some time to determine which ones would work for you. These appliances generally need either 12 volts or 110 volts to operate, so you need to know which one you have in your cab. Also, some cabs have auxiliary power units. The auxiliary power units have an advantage in that they can run power for a longer time when the engine is not running. However, some of these appliances require more electrical draw than others. Because of this, some of these appliances work best only when you have the engine running. Again, learn from the experiences of other drivers by their reviews of these appliances. Meal plan in advance to meet your nutrition goals and optimize the food storage. Buy and prepare as much food as you can at home before you head out. This will also save space and save time in the road. For example, you can have meals in aluminum foil packets in the fridge ready to drop in the stove. This also minimizes or eliminates the need to clean dishes and utensils while on the road. Make sure you have enough of the right cleaning supplies to avoid food contamination and keep the cab clean. Many of the drivers in the YouTube videos I watch prefer to use prepackaged wipes. When eating out in restaurants on the road, know how many calories you need per day using the MyPlate website. Knowing your calorie needs is important to manage your daily food and beverage choices. Look for the calorie and nutrition information. You may need to ask the restaurant for this information. Some have it on separate menus. This information can help you make informed and healthy meal choices. Calorie information may help you decide how much to enjoy now and how much to save for later. Eat half and ask for a box to go. Side dishes can add many calories to a meal. Grilled, steamed, or broiled vegetables and fruit are often lower calorie options. With the calorie information, you can make better choices. Asking for sauces or salad dressings on the side lets you choose how much to use. These sauces are often high sources of sugar and added sodium. Foods described with words like creamy, fried, breaded, battered, or buttered are typically higher in calories than foods described as baked, roasted, steamed, grilled, or broiled. Calories from beverages add up quickly. With beverage calorie information, you can find lower calorie options. Remember, small changes add up. Making healthier choices doesn't have to mean making big changes all at once. If this seems overwhelming, start off with 1 or 2 small changes, like reducing sodium and added sugar intake, and then building from there. As you read nutrition labels, learn from them. It's like anything else. It takes time and practice. For example, cook with herbs and spices to add flavor to meals to eliminate the needed added sugar and salt.
All right, let's talk a little bit about smoking and smoking cessation. The National Truckers Survey found that truck drivers are up to 2 times more likely to smoke compared to other U.S. workers. The same survey also found that smoking was 3 times higher among the female drivers compared to other women in the U.S. workforce. Smoking may be higher among truckers because it might help to combat fatigue. However, smoking does increase your risk of various forms of cancer, coronary heart disease, emphysema, and stroke. If you smoke because you're trying to stay awake, there are healthier ways you can manage your sleep and your fatigue. We'll be discussing sleep more later in the webinar. After studying civilians, an economist at the Free University of Amsterdam found that smokers average 34 sick days annually, compared to 25 sick days a year for former smokers and 20 for individuals who did not smoke at all. Smoking harms almost every organ in the body, leading to a lack of REM sleep and increasing the risk of sleep apnea. It leads to higher cholesterol levels, cardiopulmonary problems, and increased risk of deep vein thrombosis. More sick days means more days off of the road. Not only do smokers have an increased likelihood of becoming sick, they also have an increased cost of treating sickness. In addition to that, there is potential increased cost of health insurance as well. The practice of charging tobacco users more is called tobacco rating. The Affordable Care Act allows insurance companies to charge smokers up to 50% more than non-smokers through a tobacco surcharge. Although smokeless tobacco products like chewing tobacco or snuff are not inhaled like regular cigarettes, they still contain nicotine and cause a myriad of health risks. Smokeless tobacco is linked to several different types of cancer, including cancer of the mouth, esophagus, and pancreas. Using smokeless tobacco products also can cause gum disease, tooth decay, tooth loss, and it can cause the formation of white or gray patches inside the mouth called leukoplakia, which can lead to cancer. Smokeless tobacco products use increases the risk for death from heart disease and stroke. In women, smokeless tobacco use during pregnancy can also increase the risk for early delivery or stillbirth. Despite how e-cigarette manufacturers market their products, the Food and Drug Administration has not found any e-cigarette to be a safe and effective way to help smokers quit. E-cigarettes produce a number of dangerous chemicals which can cause lung and heart disease. E-cigarettes also contain acrolein, a pesticide primarily used to kill weeds, and they can cause acute lung injury and COPD, and many cause asthma and lung cancer. The benefits you'll see after quitting smoking are almost immediate, and your health and organ function will only continue to improve as time goes on. As soon as only 12 hours after you quit smoking, the carbon monoxide level in your blood will drop to normal. After about a year, your added risk of coronary heart disease is half that of a smoker. And after about 5 to 15 years, the risk of stroke is reduced to half that of a non-smoker, or reduced to that of a non-smoker, excuse me. According to Fair Reporters, cigarettes have an average cost of about $5.50 a pack, with the price of a pack of cigarettes in most states being between $6 to $8. Even if you only smoke half a pack of cigarettes a day, at the average cost of cigarettes, it would cost $19 a week and over $1,000 a year. I think we can all agree that we could, find much better things to do if we had an extra $1,000 a year. Quitting smoking can have a positive impact on those around you as well. Secondhand smoke negatively impacts everyone, no matter their age or their health level. Studies show that even short-term exposure to secondhand smoke can cause increased risk of heart attack, and kids who are exposed to secondhand smoke have more chest colds and ear infections, and infants born to mothers who smoke can have an increased risk of sudden infant death syndrome. There are also many seemingly small benefits to quitting smoking that, when compiled, add up to a large improvement in your general quality of life. Food tastes better when you don't smoke, your sense of smell improves, and your clothes and cab won't smell like cigarettes. You can also go about your day without having to plan around your cigarette breaks. If you're looking to quit smoking, it's important to make a quit plan. Set a quit date in the next week or two, which will give you enough time to prepare, and you can choose a date that will not have other stress factors present. Let your family and friends know about this quit date so that they can be a support system for you. Calculate your savings ahead of time. Calculate how much you'll save based on how much you smoke and the brand of cigarettes that you smoke, and be sure to mark significant landmarks like your first week, your month, or 6 months to a year on the calendar to note how much you've saved. Know your motivations. Note your reasons for quitting to keep yourself motivated and on track. Know your triggers. It's important to note what emotional, social, or other daily triggers make you more likely to smoke. While you're quitting, cravings will happen, and when they do, it's important to have a game plan in place as to how you'll get your mind off of them and onto something else. Plan distractions like going for a walk, completing a breathing exercise, or calling a family member to redirect yourself. Find plenty of strategies to help you quit. You may want to talk to your doctor about possible medications that could help you, and build a support system. Talk to friends, family, and coworkers about your plan to quit, and know who you can lean on for support. Explore counseling options either in person or over the phone. There are a number of quit-line phone lines you can call when you need to talk to a smoking cessation counselor. Today, there are many different mobile apps that you can use to help you quit smoking as well. Some will provide challenges to keep you motivated, provide a support network of ex-smokers, track your craving patterns and provide management techniques when you have a craving, track financial achievements, and they can even use your smartphone's health applications to track improvements in your health stats. Let's talk about the cold and the flu. Both the cold and flu are highly contagious respiratory illnesses, although they're caused by different viruses. Because the cold and flu have similar symptoms, it can be difficult to tell them apart, but in general, the flu is usually more severe than a common cold, and the flu can lead to more serious health problems like pneumonia, sinus infections, inflammation of the heart, or even respiratory or kidney failure. Anyone can get the flu, but individuals who are 65 and older, as well as individuals with certain health conditions like diabetes or heart disease, are more likely to develop some of the more serious flu-related complications. We talked about COVID-19 a little bit already, but I think it's important to note that COVID-19 is caused by a different virus than both the cold and the flu, and there are a couple key differences that are important to remember. COVID spreads easier than the flu and has a longer incubation period, meaning it takes longer before people show symptoms. Individuals with COVID can be contagious for a longer period of time, and COVID patients can also develop complications like those associated with the flu, as well as blood clots of the lungs, heart, legs, or brain. Flu viruses spread mainly from person to person through droplets formed when people with the flu cough, sneeze, or talk. Less often, a person might get the flu by touching a surface or object that has the flu virus on it and then touching his or her mouth, nose, or eyes. Many other viruses spread these ways too, so if you use these mitigation methods, you'll keep yourself safe from other things as well. People infected with the flu may be able to infect others beginning 1 day before symptoms develop and up to 5 to 7 days after they become sick. That means you may be able to spread the flu to someone else before you know you are sick, as well as while you are sick. To keep yourself, your family, and your coworkers healthy, you can follow these steps. Get a flu vaccine, avoid close contact with people who are sick, and while you are sick, limit your contact with others as much as possible to keep from infecting them. Cover your nose and mouth with a tissue when you cough or sneeze and throw it in the trash directly after, and then be sure to wash your hands. When you do wash your hands, do it often, and use soap and water and wash your hands for at least 20 seconds. If soap and water aren't available, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth to prevent the spread of germs. And clean and disinfect surfaces and objects that may be contaminated with germs that can cause respiratory illnesses like the flu. Washing your hands is one of the easiest things you can do to prevent the spread of germs and to help yourself and others avoid becoming sick. Research shows that when communities were provided with education on hand washing, it reduced respiratory illnesses like colds and flu in the general population by about 16 to 20%. To properly wash your hands, rinse them with clean running water. The temperature of the water is not as important as the fact that the water is running and not just standing in the sink. Lather your hands by rubbing them together with soap, and be sure to lather the backs of your hands between your fingers and under your nails. By lathering your hands and rubbing them together, it will create friction, which helps lift dirt and grease from the skin. Microbes are present on all surfaces under the hand, often in particularly high concentration under the nails, so be sure to rub all surfaces of your hand. Scrub your hands for at least 20 seconds. If you need a better guideline, you can hum the Happy Birthday song from beginning to end twice. Determining the appropriate length of time for hand washing depends on many different factors, including the type and the amount of soil that is on the hands and the setting of the person washing their hands. Evidence suggests that washing the hand for about 15 to 30 seconds, removes more germs from hands than washing for a shorter period of time. Rinse your hands again under clean and running water. Germs can be transferred easily to and from wet hands, so be sure that your hands are completely dry after you wash them, either by drying them with a clean towel or by air drying. The CDC recommends washing your hands with soap and water whenever possible to prevent the spread of all types of germs, but when soap and water are not available, using a hand sanitizer with at least 60% alcohol can help curb the spread of germs and help you avoid getting sick. Alcohol-based hand sanitizers can quickly reduce the number of microbes on hands in some situations, but they do not eliminate all types of germs. Soap and water are more effective than hand sanitizers at removing certain kinds of germs like Cryptosporidium, norovirus, and Clostridium difficile. Hand sanitizers may not be as effective when hands are visibly dirty or greasy, and hand washing with soap and water is recommended in such circumstances. If your hands have touched harmful chemicals, you should wash them carefully with soap and water or as directed by poison control. If soap and water are not available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Studies have found that hand sanitizers with an alcohol concentration between 60 to 95% are more effective, and that those with less of a concentration of alcohol really may only curb the growth of germs rather than outright kill them. When using hand sanitizer, apply the product to the palm of your hand and rub the product all over the surfaces of your hands until they are dry. Although they can kill many types of germs very effectively when used correctly, many people either don't use enough hand sanitizer or they wipe it off before it's dried. You can also help prevent the spread of germs by cleaning high-touch areas in your vehicle. If visibly dirty, use a cleaning product before disinfecting. Follow the manufacturer's instructions for concentration, application method, and contact time for all cleaning products and disinfectants. According to the CDC, appropriate disinfectants include bleach diluted with water, but you should be careful never to mix bleach with ammonia or any other cleanser. Isopropyl alcohol. In addition, list N EPA-approved products are powerful broad-spectrum germicides and can be effectively used to disinfect plastic, glass, and metal vehicle surfaces. All commonly touched surfaces used to access and control the vehicle or equipment should be cleaned and disinfected. This might include control knobs or panels, the steering wheel, seat belts, interior and exterior door handles. Among truckers surveyed in the National Survey of U.S. Long-Haul Truck Driver Health and Injury, 3 out of 4 drivers said that they did not get the recommended amount of physical activity. The study found that only 1 out of 4 men and 1 out of 5 female drivers said that they exercised for 30 minutes a day, 5 days a week. Getting at least 2.5 hours of vigorous physical activity a week has found to improve sleep, reduce stress, enhance alertness, and reduce the chances of truck crashes. There are many health and general well-being benefits to maintaining an active lifestyle. Regular physical activity can help to reduce stress, anxiety, and depression. It can also help to increase muscle strength, making other physical activities like those associated with driving easier. Being more active can help improve your cardiovascular health, lowering your blood pressure and improving circulation. It can increase your levels of good cholesterol and regulate weight, as well as prevent bone loss that may lead to osteoporosis. All of this can help you keep healthy and on the road longer. The American Heart Association recommends at least 150 minutes or 2.5 hours of moderate aerobic activity every week. Moving for 30 minutes just 5 days a week can help you hit this goal. Moderate aerobic activities include walking at a brisk pace, leisurely biking, or everyday activities like gardening or cleaning. Remember, any amount of physical activity is better than none. Start with little changes. Small steps can lead to big improvements in not only your physical health, but your mental health, sleep schedule, productivity, and quality of life. You should strive to get your heart rate to about 50 to 70% of the maximum heart rate for your age. More vigorous physical activities could include running, jumping rope, or biking at a pace of 10 miles per hour or faster. Joining a national gym chain will increase the likelihood you can find a location while on the road if you want to work out in a more vigorous manner. Drivers spend most of their day sitting, which can be very hard on the body. In addition to aerobic activities, stretching programs can be another part of a balanced and healthy lifestyle. Stretching can help to provide your muscles with fresh oxygen and remove byproducts, reducing overall fatigue. It can improve flexibility, balance and posture, and muscle coordination as well. By getting our muscles ready, we can make tasks like cranking dollies, pulling fifth wheel pins, opening tractor doors and trailer hoods, and general bending or twisting easier on our bodies. Stretches can be done pretty much anywhere, even in your cab or during pre- and post-trip inspections, making them easy to incorporate into your work routine. but any company-wide stretching program should be developed by a qualified professional based on the driver's job exposures.
Okay, we're going to next talk about sleep on the road. Sleep is an important aspect of your health that has a deep impact. Before we talk about sleep, how much sleep do we need and how much is not enough? Most adults need 7 to 9 hours sleep per night. As we get older, we tend to need less sleep. Severe sleep loss is defined as only getting 3 to 5 hours sleep per night. When you have one night of only 3 to 5 hours of sleep, it affects your alertness, not only the next day, but can also potentially affect you for up to 2 weeks. The quality of your sleep is influenced by many aspects of your life, including stress and lifestyle choices. If you have one night of poor sleep, research shows that you will have a decreased vigilance, memory impairment, delayed reaction times, and increased stress levels. These deficits would clearly make driving a commercial vehicle more difficult. Recall that short sleep is defined as under 7 hours of sleep. How much sleep did you get last night? If you have chronic short sleep problem, you will gain weight, have higher blood pressure, higher cholesterol, digestion problems, immune system deficiencies, an increased risk of diabetes, strokes, heart attack, some cancers, and workplace accidents. Research consistently suggests that poor sleep is closely related to workplace accidents and injuries. Sleep is an important part of your life. You spend about 1/3 of your life sleeping. Quality sleep, and getting enough of it at the right times, is as essential to survival as food and water. Your brain and body are active while you sleep, and there are dozens of changes occurring, such as blood pressure, heart rate, breathing, temperature, hormones, and neurotransmitters. These activities must occur in balance or disease develops. There are 2 stages of sleep behavior, but first let me define what it means to be awake or wakefulness. When you are awake, you are aware of yourself and the environment. This is the difference between being awake and sleeping. There are 2 basic types of sleep: rapid eye movement sleep and non-rapid eye movement sleep, which has 3 different stages. Each type of sleep is linked to specific brain waves and neuronal activity. You cycle through all stages of non-REM and REM sleep several times during a typical night, with increasingly longer and deeper REM periods occurring toward morning. REM sleep is the deep sleep state where your brain is most active. This is also the sleep state where your eyes will move back and forth, which is why it is called REM sleep. Let's go through the 4 stages of sleep. Stage 1 sleep is the transition from wakefulness to sleep. During this short period, lasting several minutes of relatively light sleep, your heartbeat, breathing, and eye movement slow, and your muscles relax with occasional twitches. Your brain waves begin to slow from their daytime wakefulness patterns. Stage 2 sleep is a period of light sleep before you enter deeper sleep. Your heartbeat and breathing slow, and muscles relax even further. Your body temperature drops, and eye movements stop. Brainwave activity slows, but is marked by brief bursts of electrical activity. You spend more of your repeated sleep cycles in stage 2 sleep than any other sleep stage. Stage 3 sleep is the period of deep sleep that you need to feel refreshed in the morning. It occurs in longer periods during the first half of the night. Your heartbeat and breathing slow to their lowest levels during stage 3 sleep. Your muscles are relaxed, and it may be difficult to awaken you. Brain waves become even slower. REM sleep first occurs in about 90 minutes after falling asleep. Your eyes move rapidly from side to side behind closed eyes. Mixed frequency brainwave activity becomes closer to that seen in wakefulness. Your breathing becomes faster and irregular, and your heart rate and blood pressure increase to near waking levels. Most of your dreaming occurs during REM sleep, especially vivid dreams. Most of your memory consolidation occurs during REM sleep, which is why memory becomes impaired with a lack of stage 4 sleep. As you age, you sleep less of your time in REM sleep. The sleep stages progress from stage 1 through stage 4 several times each night. Each time you wake up at night, you have to start back at stage 1 again, which makes you miss more of the stages 3 and 4, which are the more important stages. Lack of stage 3 and 4 sleep alters your hormone and neurotransmitter levels, which causes health effects. Another thing that determines your sleep are your biological clocks. We have two internal biological clocks, the circadian rhythm and the sleep-wake cycle, that work together to regulate when you're awake and when you're asleep. Circadian rhythms direct of a wide variety of bodily functions in wakefulness, body temperature, metabolism, and the release of hormones. They control the timing of your sleep and cause you to be sleepy at night, and also your tendency to wake up in the morning without an alarm. The sleep-wake cycle keeps track of your need for sleep. The sleep cycle reminds the body to sleep after a certain time and regulates sleep intensity. This sleep drive gets stronger every hour you're awake and causes you to sleep longer after a longer period of sleep loss. Factors that influence your sleep-wake cycle needs to include medical conditions, stress, medications, your sleep environment, and what you eat or drink. Perhaps the greatest influence is the exposure to light. Specialized cells in your eyes process light and tell the brain whether it's day or night and can advance or delay our sleep-wake cycle. Exposure to light can make it difficult to fall asleep, but also to return to sleep when awakened. If your two internal biological clocks get out of sync with each other, you will likely have sleeping problems. Say your circadian rhythm is at 3 a.m., like a photo above, and your sleep-wake cycle is at 8:20 p.m. This mismatch in time will confuse your body, which changes hormone levels, sleepiness, body temperature, etc. There are many neurotransmitters and hormones that influence your sleep by making it easier or more difficult to sleep, depending on their function. It is important to realize that there needs to be a balance of these in your body at different proportions at different times of the day. If this balance gets disrupted, there are many problems that occur, such as sleeping issues. One example, adenosine, is an important hormone that regulates the sleep-wake cycles. The concentration of adenosine changes throughout the day. It raises during the daytime and falls during sleep. Caffeine consumption prevents adenosine receptors in cells from using the available adenosine, which causes sleep problems. This is why caffeine interferes with sleep, and also why we hear recommendations to avoid caffeine consumption for 3 to 5 hours before going to bed. This is just one example, but this is complex and constantly changing. To improve your sleep, maintain a regular sleep and wake time schedule, including on the weekends. Go to bed and wake up at the same time every day if possible. Exercise most days of the week and early morning if possible. This will help establish your sleep-wake cycle. This is even more effective if outside in the sunlight. Avoid exercising at least 3 hours before bed for the same reason. Caffeine, nicotine, alcohol, and some medications are classified as stimulants, which will give you sleeping problems. Avoid drinking coffee or other caffeinated beverages such as Mountain Dew at least 3 to 5 hours before bedtime. Also, avoid nicotine and alcohol before bedtime. Some medications such as decongestants and prescription stimulants also interfere with sleep. Work with your doctor to see what you can change if you're having problems. Finish eating large meals 3 to 4 hours before bedtime. Relax before going to bed. For about an hour before going to sleep, read a book, listen to music, journal, or some other relaxing activity to unwind. Create a sleeping environment that is conducive to sleep. Quiet, dark, and a slightly cool temperature. Remove phones, laptops, and other visual distractions from the sleeping area. Some people use sound machines to create a low background noise, which may be helpful when sleeping at a rest stop. For some people, short daytime naps can be helpful. but not for others. 1 to 2 hours before going to bed, avoid emotional conversations. Heavily emotional experiences rev up the brain and make it difficult to relax. Stress interferes with sleep. One technique that helps to manage stress is journaling your thoughts. Writing down these concerns and worries allows your brain to let it go of stress, which promotes sleep. Obstructive sleep apnea is a significant medical condition, especially in the transportation industry. OSA impairs people's ability to adequately breathe when sleeping, which wakes them up multiple times each night. Each time this happens, sleep starts at stage 1 again. This keeps people in the stage 1 and 2 sleep, preventing the vital stages 3 and 4 REM sleep. People that have OSA often have chronic fatigue because of this. Their hormones are altered, which makes them gain weight, have elevated blood pressure, and other health problems. These people may sleep through the night, not realizing that they have a sleeping disorder. They also may not realize that their sleep is being broken up. Often, it's the people that they sleep with that notice these problems. The good news is that OSA is treatable. One common treatment is the use of a CPAP or BiPAP breathing device, which corrects the condition. Many people that are treated with sleep much better, which gives them more energy, allows them to lose weight, and lower their blood pressure. There are CPAP devices available made to work on 12-volt systems in cabs. There are several risk factors for OSA. The more of these risk factors you have, the greater chance you will need to seek medical attention and treatment. Your medical provider may have triggered an OSA exam if you had several of these risk factors as part of your Fed Med Card exam. Here are some additional signs that you may have to need to see a doctor about OSA. If you've been witnessed snoring loudly or not breathing while sleeping, if you wake up with a dry mouth, sore throat, coughing, or unable to catch your breath, if you are excessively sleepy during the day and have decreased energy, if you wake up not feeling refreshed, if you have difficulty staying awake in the daytime, and if you have morning headaches. When creating driver wellness programs, be sure to consult with a qualified professional such as an EAP vendor or occupational therapist. West Bend has a variety of resources available on driver health and safety, like our Tractor Factor and Best Fleet Forward newsletters. Please contact your assigned loss control representative with questions or materials or any other resources needed. In summary, because of the sedentary nature of their work and other challenges being on the road, drivers are often at increased risk of various health conditions like heart disease, diabetes, high blood pressure, obesity, and high cholesterol. By eating healthy, staying active, and getting adequate sleep, drivers can reduce their likelihood of illness and injury and stay healthy on the road longer. That concludes our presentation. We are now opening the floor up for any questions that anyone may have. We're waiting here to see if anyone's typing in any questions. Also, for anyone who maybe was not able to view this webinar, it will be posted on our website in about a month, as well as some handouts and I believe the PowerPoint slides in a PDF format.
Thank you for joining us today for our April 2021 West Bend Mutual Insurance webinar on driver safety and wellness. Thank you to Samantha Brooks, Carrie Freed, and Dave Moore for an informative session. If you have any further questions, please feel free to get in touch with your West Bend Mutual Loss Control representative.